This video, I would like to talk about the significance of doing practice. You probably would have heard this a lot of times. While you're in medical schools, your friends talking about this, practice, practice, practice. Yes, that's absolutely right. I was reading a book recently, and it says that to develop a proper habit, you have to do the same thing for 90 days. I'm repeating this again. To change your habit, you have to do something regularly for 90 days. If we apply the same concept to, preparing for your exam or preparing for your clinical exam, you need to do at least a minimum of 90 role plays. Okay, I'm not a genius. I'm just saying what someone else said. So, my advice would be do at least 90 role plays. Okay, so the best thing will be to do role plays with a group of 3 people. It'll be you and 2 more friends. One person should be the examiner. One person will be the patient or the role player, and you will be the candidate. Okay, so try to do at least 90 role plays each. Okay, so to do 90 role plays, you probably should do at least one role play per day, and you need to start preparing for your exam for at least 90 days, which is 3 months. Every time when I do a workshop, candidates come to me and ask me, how many days should I prepare? How did you prepare? You passed all your exams. What are the strategies? Can you give us some tips? There's no secret strategy, honestly speaking. I did a lot of role plays, by doing lots of role plays and preparing in a smart way, I was able to pass all my exam stations. And I will tell you the truth. I'm not telling this, because I passed my exam and now I can say whatever I want to say. I have actually done more than 250 role plays. This is true. I'm not, exaggerating, or I'm not doing anything, because I started preparing for my clinical exam, 18 months before my exam. There's a big story for that. I'll probably tell you in some other video. But so I had plenty of time. Initially, I was not doing it seriously. I used to do role plays on and off. But once I was getting closer, once I got an exam date, I started doing role plays every day. And by doing role plays every day, I've done all the mistakes I usually do in the exam. So when I went to the exam, it was easy. Luckily I had a good study partner. We had a plan and we used to go as per the plan. I used to tell him, fail me with for any simple mistake. It could be grammatical mistake. It could be missing a diagnosis. It could be anything. I used to tell him, your role is to fail me. Don't have any mercy about me. I want you to fail me. So he used to look for the minor mistakes I used to do, and I used to rectify them. And next time when I do role play, I used to avoid those mistakes. So by doing this, I've committed all the mistakes when I was actually at home or doing role plays with my friends. And in the real exam, I smashed the exam, because I know what mistakes I was doing. I was prepared. I know what to avoid. I know what to tell, what not to tell, and that's it. So this comes with a lot of practice. So 90 role plays at least if you're preparing for your clinical exam. I hope this helps. Please don't take it otherwise. This is my sincere advice to you and sincere suggestion, because I really want to help you guys. This is something I learned in a hard way, but I want you to actually implement these strategies and correct all those minor mistakes you're doing. And when you do the real exam, you should be smashing. I wish you all the best. I will see you in the next video.